Welcome to the presentation entitled Health Behavior Change to Prevent Chronic Disease and Promote Wellness in Aging. I'm Robin Majeski, a clinical associate professor in the Erickson School of Aging Studies at the University of Maryland at Baltimore County in Baltimore, Maryland, USA. The learning objectives for this presentation are as follows. Describe the incidence of chronic disease in older adults. Describe health behavior change and its importance for preventing and managing chronic disease. Describe health behavior change models such as the trans-theoretical, health belief, and social ecological models, and evaluate their potential to promote health behavior change. Describe health coaching and motivational interviewing and how these may use health behavior change models. So let's begin. Let's talk about the incidence of chronic disease among older adults. Now, according to the National Council of Aging, almost 95% of those aged 60 and older have at least one chronic condition, and 80% of those have at least two chronic conditions. And the most common chronic conditions in older adults are the following. According to the National Council of Aging, hypertension, dyslipidemia, obesity, osteoarthritis, coronary heart disease, diabetes, chronic kidney disease, heart failure, depression, and dementia. Now let's talk about some general points regarding health behavior and disease prevention. Now, reducing the risk for chronic disease requires a comprehensive approach, which includes addressing behaviors in the different domains of someone's life, okay, such as their rest and sleep, their exercise, their diet, their social support, and so forth. Okay, that's really important. And health behavior change to prevent or manage chronic disease can be facilitated through health coaching and motivational interviewing based on health behavior change models. Health behavior change models provide an understanding of the factors which may influence health behavior, such as diet and exercise, and how change in these behaviors may occur. Health behavior change models include individual and community level models. Effective health behavior change efforts often include a comprehensive approach with individual and community level health behavior change interventions to promote wellness. So let's talk about the specific health behavior change models. An individual level model is a trans-theoretical model of change developed by Prochaska and De Clemente. And this focuses on the readiness for change, which occurs, according to this model, through 6 sequential stages, and an individual may and often does actually recycle through these stages. So the stages are the following. Pre-contemplation stage. An individual is not acknowledging that there is a problem, say, with their diet, their exercise, smoking, or drinking, so they're not even contemplating making a health behavior change. The next stage is the contemplation stage, where an individual is aware that their health behavior, such as their diet or their exercise, lack of exercise, is an issue, and they are intending to change this health behavior within the next 6 months. The preparation stage. The individual is getting ready for change. Examples may include contacting a dietitian or fitness trainer for an appointment. The action stage. This occurs when the individual is engaged in changing their exercise or diet. For example, they have begun to eat healthier foods or have begun to exercise regularly. And the individual needs to be adequately prepared for change to be successful. The maintenance stage. The individual is maintaining their change in diet or exercise, for example, over a period of time. Termination stage. The individual does not desire to go back to the old unhealthy behavior. Now, individuals often recycle through these stages. Health behavior change takes time, patience, and practice. So what are some of the processes affecting health behavior change in the trans-theoretical model? Well, according to the Habits Lab at the University of Maryland at Baltimore County, decisional balance certainly affects change. or likelihood of progressing through the stages of change. And this refers to considering the advantages and the disadvantages of changing health behavior. If in the contemplation stage an individual sees more advantages than disadvantages of change, then they're more likely to progress from contemplation stage to the preparation and the action stages. And also self-efficacy. Okay, this refers to the confidence an individual has regarding their ability to make a desired health behavior change. So often, the higher or the greater one's self-efficacy is for a specific health behavior change, the more likely they are to make that change. Experiential processes. Okay, according to the Habits Lab at the University of Maryland at Baltimore County, these include the following: consciousness raising, which refers to a heightened awareness of the unhealthy behavior such as poor diet or lack of exercise. Dramatic relief, emotions regarding unhealthy behavior and interventions for this are triggered. Environmental reevaluation. Okay, this refers to the effects of an individual's unhealthy behavior on the environment are being examined. Self-reevaluation. The thoughts and feelings of the individual regarding their unhealthy behavior are reevaluated. And social liberation. Efforts with reducing the prevalence of unhealthy behavior in the community or society, such as attempts to reduce smoking or drinking, are examined. Now let's look at behavioral processes. Okay, these, according to the Habits Lab at the University of Maryland at Baltimore County, include the following. Reinforcement management, which refers to rewarding desired health behavior changes. An example of this is giving oneself a reward for meeting, an exercise goal. Helping relationships. This refers to non-judgmental, open discussion of the unhealthy behavior and the desired change. Counter-conditioning. Healthy behavior is substituted for unhealthy behavior. For example, eating a healthy snack, such as fruit or a low saturated fat food instead of ice cream. Stimulus control. Planning to avoid or manage triggers for the unhealthy behavior. For example, an individual may plan what they're going to do when they go to a party and they see a lot of high sugar, high fat food that they may want to avoid. And self-liberation. This refers to deciding on and committing to a course of action to change the unhealthy behavior. Now let's look at evidence for the trans theoretical model. Does it work? Well, some randomized controlled studies support the use of the trans theoretical model of change-based interventions to support physical activity in healthy adults, and some do not, so the evidence is kind of mixed. Okay. A 2022 systematic review of 10 studies with adults with chronic health conditions found that of these, 8 studies supported the use of the trans theoretical model, predicted or improved adherence to medication regimens. Now let's look at the health belief model. This is an individual level health behavior change model developed in the 1950s by social scientists who worked with the U.S. Public Health Service. And it aims to explain health behaviors and motivation for health behavior change. So the elements of the health belief model are the following. Perceived susceptibility to disease. This refers to how vulnerable one sees oneself to a disease. And the more susceptible one sees oneself to a disease, the more likely one is to change the health behavior that may help them to reduce the risk for that disease. For example, the more susceptible one sees oneself to heart disease or stroke, the more likely one may be to changing their diet to a low saturated fat diet and to exercising more and to perhaps stop smoking. The next element is the perceived severity of disease. This refers to whether the individual sees the disease as severe or less severe. The more severe an individual perceives a disease, the more likely they are to change the behavior that puts them at risk for that disease. The next element is perceived benefits of health behavior change. This refers to an individual's perception of the advantages of a particular health behavior change. Examples are an individual perceiving that changing to a low fat diet and exercising may help them lose weight, feel better, have more energy, and reduce their risk for heart disease and stroke. So they are alive to share important events with their family that may be very important to them, an important benefit that may motivate their health behavior change. The next element is perceived barriers to health behavior change. This refers to obstacles to changing health behaviors, such as, changing one's diet or exercise. Examples of barriers are lack of availability of safe places to walk or engage in exercise, lack of an affordable gym membership, lack of time due to work and or family responsibilities, and lack of support from one's family. Cues to action are the next element. Okay, cues to action are things which trigger a decision to change an unhealthy behavior. Now, examples of cues include health information and advice from others, or when symptoms of disease such as chest pain or concerning lab values indicating lipid abnormalities. And the last element in the health belief model is self-efficacy with health behavior change. This refers to the confidence an individual has that they have the ability or the skills to make the desired health behavior change. For example, if an individual realizes they have the skills to make desired changes with their diet, it's more likely that they will change their diet. One way to increase self-efficacy with dietary change is to, of course, consult a dietitian who can help the individual identify and make healthy dietary changes with their diet. Another way to increase self-efficacy with exercise is to perhaps take classes, fitness classes, or to work with a fitness trainer. So does the health belief model work? Okay, what's the evidence for this model? Well, a systematic review and meta-analysis found that higher perceived susceptibility to COVID, perceived severity of COVID, perceived benefits of COVID vaccination, and cues to action predicted the intention to receive the COVID vaccine. And in another systematic review of 21 studies with over 15,000 participants, the study found that perceived susceptibility, perceived benefits, and self-efficacy were indeed correlated with the intention to and actual use of interventions to prevent cervical cancer. Perception of more barriers was correlated with less probability of using cervical cancer prevention interventions, according to that study. Now let's look at the social ecological model. Okay, this is a community level or a community-based model which aims to comprehend the impact of the interaction of the individual, family, friends, community, and societal factors on, say, health behavior. And it was developed by Uri Bronfenbrenner in the late 1970s. This model has been used to understand the social contextual influences on health behavior, such as the influences of family, community, work, faith community, and society with its policies and laws and culture to develop multi-level interventions to promote health behavior change and health promotion efforts. So what's the evidence for the social ecological model? Well, a recent systematic review of 29 studies using the social ecological model found that both individual and organizational level or church facilitators and barriers for disease, topic, or behavior that are present when conducting health behavior or health programs at African American churches did make a difference. Now let's talk about health coaching. Health coaching refers to a process in which a health coach and individual work together to help the individual do the following, according to Vanderbilt University health coaching program. Identify their goals for health behavior change. Help the individual, for example, to identify the gap between where they currently are and where they would like to be with regards to their health behavior change goals or their health goals, whatever those goals are. To identify what's most important to them, which would enhance their motivation for change. to assess their readiness for health behavior change, which can be done, for example, using the trans-theoretical model of change, to assess factors which may influence the likelihood of health behavior change, which can be facilitated by using the health belief model or other model of health behavior change, to learn attitudes and skills for health behavior change, and to evaluate progress towards desired health behavior change and health goals. Now, health coaching is often conducted over 6 to 8 coaching sessions for about 30 to 40 minutes, according to Simons and Bolivar, 2013. Now let's talk about motivational interviewing. Health coaches may use motivational interviewing, which is an evidence-based, goal-focused type of counseling or interaction to enhance the individual's motivation for and reduce the resistance to health behavior change, according to Miller and Roenick. It includes the following characteristics, according to Miller and Roenick: non-judgmental listening and responding, providing knowledge and guidance to facilitate change, honoring the individual's self-determination, their values and their preferences and what's most important to them. And it is collaborative. It's a trusting, non-judgmental, collaborative relationship. And it's short. Motivational interviewing consists of just 1 to 2 sessions. Now, motivational interviewing involves the following steps, according to Miller and Roenick, 2013. Engagement, which is the establishment of a trusting, collaborative, goal-oriented partnership between the health coach and the individual. Focusing. This is an agreement that includes a decision regarding health and health behavior goals or goals which are established, and the responsibilities of both the health coach and the individual. Evoking. The health coach works with the individual to enhance intrinsic motivation for health behavior change. And planning. The health coach and the individual collaborate and decide on the process through which health behavior change will occur. The health coach helps the individual learn the knowledge, the skills, and the attitudes necessary for health behavior change, for example, for stopping smoking, for exercising more, or for changing their diet. So what's the evidence for health coaching and motivational interviewing? Does it really work? Well, according to a 2020 systematic review and meta-analysis of 15 randomized controlled studies, it found that motivational interviewing and education had positive effects on health behavior such as physical activity, health responsibility, diet, and cardiovascular disease. According to another systematic review, a meta-analysis of 12 randomized controlled studies with approximately 2,500 adults with hypertension, done in 2023, this study found that health coaching improved blood pressure, diet, and self-efficacy with hypertension management. And a 2020 systematic review, which included 8 studies with 758 individuals with heart failure, ranging in age from, say, the late 50s to the late 70s, found that motivational interviewing provided over a greater length of time and more frequently, it may reduce the risk of hospital readmission through self-care behaviors and adherence to medication. So that's the end of this presentation, and I hope you have enjoyed it and found it beneficial. Thanks.